Hi, my name is Shelby Wages, and I'm going to be demonstrating my bathing and hygiene for my Checkoff 2 videos. So we would first want to enter our patient's room, introduce ourselves, practice proper hand hygiene, and then we would want our patient to identify themselves using 2 identifiers, and we would check their wristband to make sure that that was correct. And next we would want to ensure our patient's privacy. And then make sure we had all of our supplies for our bathing process. So this is going to be our washing bucket, and then we would have a rinsing bucket. And so next we would want to make sure that our bed is at waist level to ensure proper body mechanics. And then we would also want to lower the patient's head a little bit, making sure that they stay comfortable. And then next we would lower the handrail and remove our patient's pillow. We would then put a towel behind their head. And then we would provide a bath sheet for their comfort and their privacy. And if they were able, they would hold on to the top of the bath sheet. Okay, so first we're going to start with their eyes. So we would go from inner to outer, and then next we would do the other eye using a different area of the washcloth. And then we would gently wash their face. And if they needed oral care, we would go ahead and provide that. If they could do that themselves, they would do that. And if they needed help, we would do that, being very careful not to initiate any gag reflexes and to do that properly. We would provide them a bin to spit in if they needed it. Also, if they had dentures, we would have our gauze finger and we would remove the top denture first and then the bottom denture, letting them sit in a solution if needed. And we would also make sure to brush those dentures. If they were unconscious, we would want to make sure they were in a side laying position, and we would also have suction nearby in case we needed to suction out any extra fluid so they don't aspirate. We would also have a cup to keep from the saliva from getting on the bed or anything like that. So after we do their face, we're going to do their arms. So we want to, again, make sure we're ensuring our patient's privacy. And then we're going to put a towel here. Oh, I'm sorry. I'm going to use my cue and say that before washing our patient's face, we would ask them if they wanted any soap in their water. And if they did, we would need to rinse that and dry that area. So for their arm, we're going to use our washing bin. And then what we're going to do is start from fingertips to arm using long, firm strokes. And then we want to make sure that we clean in between their fingers. And then we would rinse and dry that area as well. If they needed nail care, we would possibly let their nails soak in a solution for a little bit while we are bathing them. And then we want to make sure that we cut those nails straight across and then if needed, we would file them to shape up the edges. After we do that and we rinse and we dry, I would move around to the other side and do the same thing with that arm as well. And so after that, we're going to move our bathing sheet down. And we would have our gown removed, but for demonstration purposes, we're not doing that. To remove the gown, we would want to remove it from the unaffected area or where there wasn't any IVs or drainage tubes or anything like that first. And then that way it makes it easier to get the gown off of the affected area. So once you have that and you're ensuring their privacy, you would take your rinsing cloth and or your washing cloth, and you would wash their chest in circular motion. And then if they were a female, you would use the back of your hand to lift the breast and wash under their breast. And then for the abdomen, you'd want strokes like this, down and then and then again, we would rinse and dry that area as well, being sure to wash in any folds or creases. And so next, we would do the perineum area. And for a male, we would start off by washing the meatus, and we would do that with circular motions going from inner to outer. And then we would wash the shaft going from tip to base. And then we would wash the scrotum, being very gentle and careful. We'd also want to make sure that before that we would wash their inner thighs with circular motions. And then we would turn over our patient onto their side, having them grasp the handrail if they needed to. And we would wash the outer buttocks first and then the inner. Again, using circular motions for the outer. So after all that, if need be, we would then wash their legs. So we would take this and ensure their privacy. And we would move our towel. Make sure that was underneath there. And we get our rag from our washing basin. And we would go from upper and then down and long, firm strokes. And again, we would do that with our rinsing and with our drying. And then after doing this leg, we would move to the other side and do the other leg. And then we would want to wash the feet. Being sure that we get in between the toes. And then again, we would do that with our rinsing and our drying. And if they needed, we would soak their feet before we would trim their toenails. And again, we would want to make sure that we did that straight across.